results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back and talking about some interesting cases, actually some new unbelievable cases. So again, if you have questions, call us at 212-CHOICES. During the week, if you want that booklet and DVD, we have a separate booklet for brain tumors, prostate cancers, and body cancers, 3 separate booklets. Call us, and we'll send it out at no charge with a DVD. Hello, it's Dr. Lederman on the radio. Good morning. How are you? Can you speak up, please?
Yes, I'm calling concerning actually my sister-in-law, who this very week was diagnosed with endometrial cancer.
I'm sorry to hear that.
And I'm wondering if your radiosurgery procedures would be effective for such a cancer.
We do treat many endometrial cancers. We would need to know the stage and more about her. So you may want to call me back after the show if you know more about the case, or she can call and we can talk about the stages and the treatment for each stage.
I know she was just diagnosed this week, I believe, with a needle biopsy, and now they're certainly considering surgery and also different types of treatments, so I really couldn't answer those questions, but I was just curious as a general...
Yeah, radiosurgery and radiation is used. It's very successful. Endometrial cancer is a cancer of the lining of the uterus, so it's that part of the uterus that comes out every month in the menstruation. It's kind of the blood and debris. The uterus gets ready every month to have a baby. So every month, if a baby doesn't get fertilized, if an egg doesn't get fertilized, then that lining sloughs off. So endometrial cancer is that lining, and sometimes it causes cancer. It's usually diagnosed early because there's signs of abnormal bleeding. So for most women who have abnormal bleeding, they need to get worked up. Usually they get something called a D&C, which is just kind of like a biopsy of the lining to show if there's cancer or not.
Very good. Well, I'll certainly tell her about that, and hopefully she calls you.
All right, thank you. God bless you. If you call during the week, we will also send you the booklet and DVD.
Okay, well, thanks again.
Thank you. Good luck. Bye-bye now. So we had this woman who presented, 58-year-old. She had a sore throat in March. She was worked up. She went to a big hospital. They did a PET scan. They did a biopsy of her lymph node in her chest. They did a biopsy of her lymph node in her neck. Both were positive. They did a biopsy of a lymph node in her groin, which was negative. And she came to us. She said she had lung cancer, and she was planned to get treatment. Excuse me again. Good morning, Radiosurgery New York. You're on the air. Hello? Okay, I don't hear anybody, so can you hear me?
Hello, can you hear me? Yeah, I'm sorry. I put my headset off. Can you hear me?
Yes, what's your question?
Basically just called to get some information. A friend of mine was...
Okay, well, call us during the week. You can call us during the week, and we'll put a package of information and a DVD in the mail to you at no charge.
Okay. You got it. Thank you.
Thank you. God bless you.
Yeah.
That's true for any of you. If you want a packet of information and DVD, just call us during the week at 212-CHOICES. Anyway, this woman came with a sore throat. She had a positive mass in the neck, positive mass in the chest, and the groin was negative. She called us. She said she had lung cancer. She's planning to start radiation on Monday. She came yesterday afternoon at 1 o'clock, and we sat down with her, and went over her documents. Now, she said she had lung cancer, but she had a PET scan that was completely normal in the lung. So how can you have lung cancer when your lung is totally normal? And remember, she presented in March with a sore throat, and no one ever thought back to listening to the patient. Listening to the patient understands and can tell you a story that is most important. So we went through all the documents, and I tell you, it's so critical. You could spend an hour or 2 hours. It's not just a phone call in 60 seconds what to do. No. To take care of a patient means to examine the patient and get a history and listen to the patient and look at the documents. I went through a pile of documents. Well, she had a PET scan that showed a mass in the nasopharynx and the tonsil that everyone had ignored. And in fact, remember, she had that soreness in her throat that started this whole process. It's still there. She never had a cancer in the lung. Her lung is totally normal. Now, she was planning at this other big hospital, and I mean a big hospital in New York City, to get chemo and radiation for lung cancer. They're going to radiate her lung even though she had no lung cancer. Wow. Is it tough to be a patient? Yes, it's very tough to be a patient. So you better be sure you're on the right trajectory, because if they're going to spend the next 6 or 8 weeks giving her radiation for lung cancer that she doesn't have, she's probably going to be pretty unhappy in the future. Fortunately, we spoke to the radiologist, we spoke to the pathologist, we had them on speakerphone. The patient and her husband heard the whole conversation. They heard there was nothing in the lung. They were shocked. We found this tumor in the nasopharynx and tonsil. She's being seen Monday morning at 10 o'clock by an excellent ENT doctor to confirm the diagnosis and to get her on the right path. What a difference a second opinion makes. Wow. Wow, oh wow. And we have another woman who came to us, 60 years old. She was told she had a 1-centimeter breast cancer. She's a PhD. She's a psychologist, speech pathologist. She was worked up at the 4 biggest hospitals in New York. Not 1, not 2, not 3, 4. They all told her she had a little cancer in the breast. She had skipped mammograms for 4 years. Remember, we talked about the importance of mammography. They went in to remove a 1-centimeter tumor. It turned out to be a 6-centimeter cancer, and more cancer left behind in the breast, and 5 of 10 lymph nodes positive. And they're still doing x-rays of the breast and MRIs of the breast when, in fact, she's never been staged. She came to me yesterday afternoon. We reviewed all the documents, reviewed the history. I spoke to the pathologist. The patient was with me when I spoke to the pathologist. She was shocked to hear that her cancer was more than 6 centimeters. And after being at the 4 biggest hospitals, no one ever told her the pathology, the positive margins, the importance of the stage, having a 6+ centimeter mass, having 5 positive lymph nodes in her axilla, and cancer spread beyond the lymph nodes. And yet still, no one got her staged. So we arranged immediately, and we got insurance company approval to get a PET scan to stage this patient to know exactly where the cancer is. Instead of focusing with a little microscope on the breast, she needs to know, has the cancer traveled or not? It's already massive in the breast. It's already multiple lymph nodes. It's already beyond those lymph nodes. Has it spread? So, wow, what a difference a day makes. What a difference a second opinion makes. We encourage everyone to get a second opinion, to sit down, spend some time with the doctor, call us up, we'll close the door, sit down, and get you all the information you need to make the choice that's best for you. It's already the end of the hour. We have 4 more shows this weekend on WOR at 1:30 a.m., 3 a.m., 6 a.m. tomorrow, Sunday morning, and 9 p.m. So there's 4 more shows. They're all unique. Give us a call at 212-CHOICES. If you have a question, 212-246-4237. Thank you for listening. Have a great weekend, and
Thanks
God bless
for tuning
you.
in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C, cancer, a lot of times people have gone through prior chemosurgery or radiation and it just didn't work or didn't get the desired effects. All of a sudden you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who have already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES, at 212-CHOICES, at 212-CHOICES, at 212-CHOICES, at 212-CHOICES, at 212-CHOICES, at 212